healthy senior waking up from a routine hip replacement surgery. They seem completely physically fine initially, but they cannot remember their own grandchild's name the next day. A week later, their entire personality has changed entirely. They are experiencing severe postoperative cognitive dysfunction. This is not normal aging or early onset dementia. This is a severe hidden neurological brain injury. The medical establishment rarely warns seniors about this severe surgical risk. They treat general anesthesia as a simple, harmless chemical sleep. Our clinical medical board reviews raw surgical data daily. We ignore hospital marketing and outdated medical dogmas entirely. We focus strictly on peer-reviewed objective biological truth. You need raw clinical data to protect your brain chemistry. I invite you to subscribe to this educational channel today. Join our exclusive community of dedicated biological truth seekers. Let us decode exactly what anesthesia does to your brain. Think of your brain as a massive, bustling digital city. The neurons are the millions of busy electrical telephone wires. They constantly send rapid messages to keep you awake. General anesthesia acts like a massive chemical snowstorm. It blankets the entire digital city in heavy, thick ice. It physically forces the electrical telephone wires to shut down. This is not normal biological sleep under any circumstances. Natural sleep actively repairs your brain and consolidates your memories. Anesthesia is a medically induced, reversible chemical coma. This chemical coma brings us to a massive neurological trap. When you are 20, your brain easily melts the chemical ice. The telephone wires quickly reconnect and function perfectly again. But human biology fundamentally changes as we naturally age. By age 60, your blood-brain barrier becomes highly fragile. The chemical snowstorm penetrates much deeper into senior brain tissue. The specific drugs used in general anesthesia are highly fat-soluble. Your brain is composed of nearly 60% fat tissue. The anesthetic chemicals soak deeply into your lipid membranes easily. In older adults, the clearance rate of these drugs slows dramatically. Your liver and kidneys process the toxic compounds much less efficiently. The chemical residue sits inside your neuronal synapses for weeks. This toxic residue triggers the release of dangerous inflammatory cytokines. Cytokines are your immune system's chemical alarm bells. They cross the fragile blood-brain barrier and attack healthy neurons. This friendly fire destroys the microscopic bridges between your brain cells. Your memory consolidation pathways in the hippocampus are severely disrupted. This causes severe neuroinflammation and destroys delicate synaptic connections. Your brain struggles to reboot the massive digital city. Millions of seniors experience postoperative delirium immediately after waking up. They hallucinate and become highly agitated or severely withdrawn. The hospital simply medicates them and sends them home quickly. But the severe neuroinflammation continues burning silently for months. Up to 40% of seniors experience postoperative cognitive dysfunction. They lose their sharp memory and their quick executive function. Some never fully recover their original cognitive baseline, ever again. Surgeons dismiss this as a normal temporary surgical side effect, but the clinical data shows it accelerates permanent cognitive decline. It physically ages your brain by several years in hours. The risk increases exponentially if your blood pressure drops during surgery. Anesthesiologists often allow blood pressure to drop to minimize surgical bleeding, but this starves your senior brain of critical oxygen and glucose. A starved brain cannot defend itself against severe chemical inflammation. You must actively protect your fragile neurobiology before any surgery. The actual clinical protocol requires strict preoperative cognitive optimization. You must demand a thorough preoperative cognitive baseline assessment. Ask your physician to document your exact memory function beforehand. You must also fiercely advocate for regional anesthesia when possible. Epidurals and spinal blocks avoid putting your brain into a coma. If general anesthesia is absolutely mandatory, you must demand specific monitoring. Ask your anesthesiologist to use an EEG depth of anesthesia monitor. This advanced device perfectly tracks your actual brain waves during surgery. It ensures they use the absolute lowest chemical dose possible. Overmedication during surgery directly causes severe postoperative cognitive dysfunction. You must drastically lower your systemic biological inflammation before surgery. High baseline inflammation acts like gasoline on the neurological fire. Eat a strict anti-inflammatory diet for 4 weeks prior. Eliminate all ultra-processed foods and refined synthetic sugars entirely. Incorporate high-quality omega-3 fatty acids to protect neuronal walls. You must hydrate aggressively in the days leading up to surgery. Dehydration concentrates the inflammatory markers in your bloodstream severely. Ask your surgeon to avoid prescribing anticholinergic medications if possible. These specific drugs are often given to reduce nausea and secretions, but they aggressively block a crucial neurotransmitter called acetylcholine. Acetylcholine is the primary chemical messenger for learning and memory. Blocking it in a senior brain guarantees severe postoperative confusion. You must ensure your vitamin B12 and D levels are optimal. These vitamins are critical biological armor for your central nervous system. Request a simple blood test at least 1 month prior. You must also bring familiar items to the hospital recovery room. Family photos and your own glasses help ground your brain immediately. Hearing aids must be worn as soon as you wake up. Sensory deprivation severely worsens postoperative delirium and cognitive panic. You must get out of the hospital bed as quickly as authorized. Physical movement pumps rich oxygenated blood directly back into your brain. This physical blood flow flushes out the lingering anesthetic toxins rapidly. After surgery, you must aggressively pursue cognitive rehabilitation immediately. Do not lie in bed staring at a blank wall. Engage your brain with complex puzzles and deep social interactions. This forces the electrical telephone wires to actively reconnect faster. Never accept cognitive decline as a normal surgical outcome ever. You must carefully discuss these specific protocols with your anesthesiologist. Remind them that aging brains require highly precise chemical dosing. Do not avoid life-saving surgery out of absolute blind fear. But you must prepare your brain like an elite biological athlete. We will continue to review the peer-reviewed clinical data. Protect your neurological health and stay perfectly objective always. Thank you for seeking the biological truth with the Medmetrics today.